Problems that we see associated with Down syndrome from a medical perspective fall into several different categories. We see problems in the newborn at birth. We see medical issues that are acquired over time throughout childhood and early adulthood. And then we see medical issues that affect the aging adult. In the newborn, what we're most concerned with is whether the newborn has any evidence of a malformation of the heart structure or of the GI tract. Fortunately, these issues are usually straightforward to diagnose, and in the proper medical center can be treated surgically with a very high degree of success. We also see cataracts in a very small number of our children. We may see hypothyroidism in a small number of children. And we may see something called transient myeloproliferative disease, which is a overproduction of white blood cells and platelet cells in the newborn period, which requires treatment by a hematologist oncologist. So most of what we see in the newborn period can be treated in the modern medical setting. Likewise, what we observe in children, slightly older children, is a predisposition for thyroid disease. We may observe sleep problems and sleep apnea, which can be caused by enlarged tonsils or a crowded airway. We can see autoimmune disorders such as celiac disease or gluten sensitivity, which can cause GI symptoms and malabsorption and poor growth. We may see other things like acquired hearing loss due to frequent middle ear infection, or visual problems that develop over time that are not present at birth. So it's very important in children to have an annual vision and hearing checkup, to have an annual thyroid checkup, and to be in touch with a pediatrician who's at least comfortable and familiar enough with development to understand if the child with Down syndrome is developing typically for a child with Down syndrome, or whether there are extenuating complications and circumstances. Sometimes we do see childhood onset behavior or psychiatric issues. We see behavior issues that very closely resemble autism. We may see something as common as attention deficit hyperactivity, risky behavior, impulse control issues. And these can be usually managed by a combination of behavior therapy, behavior management, improving health care generally, training the parents how to interact with the child, and through, if necessary, medications. When we get into the adult years, we see different types of issues that come up. We see a high degree of adult sleep apnea that may have consequences on mental health, because there is a slightly increased risk of depression, anxiety disorders. And while these are treatable with medicine or with therapy, they don't always respond as they should or as we would predict. And sometimes it's because there's a significant sleep issue lurking in the background, and you're not going to fully treat the mental health condition until you treat the sleep issue as well. Again, we're checking vision, hearing, thyroid yearly in our adult population as well, because these things can develop at any age, not just during childhood. The best practices are some of the things that I've mentioned, where we have scheduled checkups on an annual basis, where the vision, the hearing, the thyroid are being checked. At the slightest amount of suspicion, we are getting a sleep study, or we're trying to find some way to record sleep either with a simple iPhone or audio device or video device to document whether that child is having apnea or pauses in respiration during sleep. So this is all becoming part of best practice for the medical issues. For the developmental concerns that go along, which usually involve speech and language delay and motor delay, we have physiotherapy that our children get from a very early age to assist them with motor movements and learning to support themselves in standing and walking and eventually running and riding bicycles and running around and having fun just as other children do. We have speech and language therapies to help them with enunciation and speech articulation. And we may have things like music therapy and play therapy to help the children to develop their social and body awareness and social skills. So the new frontiers in research are interesting. There's a strong movement in the genetics and molecular biology community to understand the impact of what it means to have an extra copy of chromosome 21, because this is the root cause of Down syndrome, a condition known as trisomy 21. So on that chromosome we have about 350 genes that are present in an extra copy. They're not mutant genes, they're not abnormal genes like you think of in other genetic conditions. What you have is an extra dosage of genes. You have 3 copies instead of 2. And there's a lot of interest in molecular biology to understand how these genes interact, not just with each other, but with the rest of the genome of about 25 or 30,000 genes, and in particular how they impact on development of the brain, the organization and the function of the brain at the molecular level. There's also great interest in how it affects development of the heart, development of the GI tract. Things like this are really on the forefront of our understanding in Down syndrome. There is an interest in conducting clinical trials and clinical research in children and young adults, particularly in the area of medications or novel biologic therapies that may minimize the impact of chromosome 21 on brain development, which leads to the intellectual disability and motor problems and speech problems. So there have been some pharmaceutical companies that have come forward with novel compounds, ostensibly to improve memory, to improve learning in young adults. Likewise, there's a great deal of interest in aspects of early aging and dementia that affects people with Down syndrome over the age of 45 or 50. And much like the general population, we haven't been that successful in identifying successful treatments for Alzheimer's type dementia. But because people with Down syndrome are prone to develop this in their late 40s or early 50s, there are some clinical trials going on to look at the efficacy of those compounds. I think in the ideal world, we would have some biologic therapies that would reduce or lessen the impact of chromosome 21 on the effects on brain development that lead to the intellectual disability. We're not there yet, but the new biology presents a lot of opportunities. And in the meantime, we encourage the best possible medical care and the best possible amount of love and education for families of children who will help them in the way they would help any child to develop and to be at their best. There's a lot that can be done by families that doesn't require fancy medicines or fancy interventions. And you know, we've had as much success on that front as any other. And I see that in India, and I see that in other countries around the world.